So these are the social people.
Well, I hope. We'll see if any of them unmute and talk to you, but that's the plan.
I understand it's late on Thursday. IM might be as far as anybody wants to go.
I remember Wednesday nights being the nights to go out, so I'm sure that's changed in 20 years. But Thursday night there was nothing going on, so maybe volleyball. I don't know. Maybe volleyball.
That's not what I remember. If I remember right, there was never anything going on because I wasn't invited to anything. Wayne, is that you?
Yeah.
Oh, okay, great. There's nothing going on now thanks to the plague. Yeah, I know it. I agree with you, Graham. I can't relate to the experience of going to school during COVID for sure. I also agree. And the range of plagues, it's not as bad as some historical ones. Okay. And I see Eric joined us too. So, Tom, are you good if we get started here?
Yep, I'd say kick it off, and then
Okay.
once we'll get the first part of the meeting out of the way. So I'll let you guys decide who's talking and take it over.
Sure, perfect. So basically, I'll do an intro. Joe Tebbin will take over in the middle, and then I'll do another outro. We'll see how this goes. Let me start sharing my screen. Based off of last time. There we go. I'm probably not even going to go into presentation mode. I'll just stick with it this way. Great. So my name is Adam Emerson. I'm a product manager at Sanford Health. With us, we have our team, Joe Tebbin, who's an app dev manager. And like I said, he's going to take over the rest of this presentation after I get to the first couple of slides. We also have Eric Ortega, who's a senior project manager for technology solutions in Sanford Health. And we also have Wayne Wang, who is a software engineer for Sanford Health Imaginetics. All right, so the overarching goal of this presentation was to promote shamelessly the 2020 Sanford Health Hack, which is a hackathon, a team-based innovation competition that has $25,000 in prize money for the winners. The kickoff for that is October 16th. There's more on that at the end, but if you are the type that gets bored, or maybe you're running short on time, that QR code is on every slide in this deck. If you want to point your camera at it and scan it, it'll take you right to the registration page. Great, so here's our goal for today, a little bit about Sanford Health, a little bit about technology solutions, which is where myself, Joe, Eric, and Wayne all report into. And then we'll get into sort of the meat of the discussion, which I'm kind of setting Joe up here. The bus is on its way and we'll see if he's under it. But I created this deck from a product manager's standpoint, and Joe is an engineer through and through. I think, Joe, you're from DSU, if I'm not mistaken.
I am, yep.
So he is going to attempt to inject actual technical value into these purely product slides. So if at any point it gets awkward, it's my fault, not Joe's. And then, yeah, after that, we'll go through the health hack. So from there, Joe, and we didn't clarify this one point, Joe, did you want me to continue to click or do you want to take over presentation?
No, I demand control. So give me one second here.
You'll have to fight me for it.
Yeah, I know.
All right.
All right. So I'm going to be contradictory right off the plate, and I'm actually going to go into presentation mode. Whoops. And so please let me know if you see the slide deck that you had up.
Yeah, we got slides.
All right. Okay, so like Adam was saying, I am a software development manager here at Sanford Health, and you know, we're kind of under the assumption that anybody on the eastern half of South Dakota really knows who Sanford Health is. But just to give you a little bit of background, here's a little snapshot of the area in the U.S. that we are really in today. And one thing I do want to call out that I don't think a lot of people may know or realize is this is a pretty big footprint for a health system, and this really came about in a couple of years ago in 2018 when Sanford Health and Good Samaritan Society merged. The Good Samaritan Society was in 27 states at one point in time. They were more a long-term care organization. So think of things like nursing homes, senior living facilities. And then when we came together with Sanford Health, who is really in that, what you think of as healthcare, hospitals, clinics, it really, it doubled the size of people providing that healthcare. But what it really did was it that we're at and the types of services that we provide. And so I'll talk a little bit about that in these slides that we put together, because that is still a problem that exists in healthcare in general. Because right now, one of the main selling points was that is Sanford Health now as an organization can truly take care of somebody from cradle to grave. You can be born in a Sanford hospital and you can live out your remaining life in a nursing facility. And so that presents some unique challenges, especially in the year that we're having, because we know that it's really the most vulnerable people that we're dealing with today in this plague, as it's been branded here, is really in those aging population. One thing you also may not be aware of is Sanford is really across the world, not just across the country. And so this just gives you kind of an understanding of the size and reach of Sanford as a health organization. I don't think we take up all of China, but we're in China. So here's just some quick statistics. Again, as you think about, a place that has an opportunity to innovate, a place that brings value to the community, these numbers really speak to that. We have over 2.9 million in that post-acute, that senior service area, and that again, with what we're going through right now, brings some unique challenges. So who we are, this is a slide I might fumble with a little bit, but so I'm going to go skip to the next one. Here's what we really want to focus on today, and what we're really focusing on with what we're terming our health hack, right? We're talking about building unique solutions that provide to solve problems in our, not just organization, but in our industry. And to me, and I'm a little biased because I have a 2-decade background in building solutions, I really think about that being the product management. What are we actually building? And the application development, the actual execution of those ideas. And what this health hack really is about is combining those two things. Here's the problem we have. Can you as a team creatively kind of dive in and solve this problem? And at the end of the day, potentially walk away with something that is kind of iteration one of a potential solution for that problem. And so, you may think of digital health as kind of the hot industry right now, right? It's, how can you have all these problems when there's so many products out on the market that can make people live healthier lives? Why is that? Why is it such a problem to solve with the resurgence of all these different technologies that are coming about? 23andMe, DNA testing, MyFitnessPal, digital devices, Fitbit, right? And you can just see from this chart here, kind of the money that's going in it today. This is where the real problems are to solve, in my opinion, in our society, in our politics. And there's substantial dollars going out there to try to solve this in the private market. And the real question is, well, why isn't it working? Why don't all those dollars translate into actual solutions? Why don't those dollars translate into people living healthier lives? Why don't those dollars, quite frankly, translate into fewer dollars spent on people's health care? Because as we look at this next chart, this is where we're really seeing the rubber hit the road, especially look in our country. We have all this private money going to solve this digital health problem, but overall, not just the amount that we spend as a country, but just take a minute to take in the actual rate of increase of the dollars we're spending in this country. And so, that is really the crux of what a lot of work that Sanford Health does, is try to solve that, right? How can we make people healthier earlier and in the middle of their life? Because at the end of the day, that's what's going to make our health systems more efficient. We have a ton of great, again, solutions for our digital health. We have a ton of money being spent, but why aren't they getting better? Well, a lot of that is really no one's really defined what the problem is. No one's really said, hey, if you solve this, that's what fixes the kind of disconnect that we're seeing today. And really, it's about aversion to change. People in organizations don't really always see the value in changing what they're doing. And then also incentivizing people to actually make that change in their lives is not as obvious potentially or straightforward as we might just take granted for it being. And I really like this quote that Adam put on here too. If I were given 1 hour to save the planet, I would spend 59 minutes defining the problem and 1 minute resolving it. I think that has a couple different connotations, but me as an engineer, I always think about, well, what's my biggest problem? Even in the role that I'm in Sanford today, what's my biggest problem? One of my biggest problems for our team in general, when we build something, is our stakeholders, the people that want us to build it, don't always know what they're trying to solve or what they actually want, right? Sorry, I'm going to skip that one too, unless you want to comment on this slide.
The only point on this one is in healthcare, it's easy to be mad at the system. If you want to change the system directly, you need to focus on laws, change the laws. If you want to focus on solutions, that's where we can focus in on technology. And that's where innovation and disruption start.
Well said. Well said. All right, so let's break down what financial incentives means. And really, it's a through relationship between what we would call in healthcare a payer, a patient, and a provider. So the patient, that's pretty obvious. That's you and me. We pay a fee to a payer, the insurance company, to provide us insurance, right? And we get that insurance in case we need value from a provider in order to, say, save our lives or provide emergency service, right? We basically pay insurance in order to prevent that catastrophic. We don't pay insurance because we want to see a doctor for a checkup, right? We pay it for those things that we don't know or can't predict, or as that almost way to save ourselves from the unknown. I mean, speaking from example, when I graduated from Dakota State at the age of 20, I had no idea that my first job would be so important to me, because at the age of 21, I contracted stage 3 cancer. Insurance and paying that monthly fee, well, people my age would have said, well, I'm not going to get sick. I don't need that. But that saved me from financial ruin. In having that and being able to be cured by, at that time, Sioux Valley, which became Sanford. That's why this model exists. It's for those things that you don't know are going to happen to you. And it's somewhat of a bet in the way it works today, right? And in this case of the payer reimbursing the hospitals, well, out of pocket, I still paid probably 12, maybe upwards of 20 grand when it's all said and done. But that payer provided that hospital the funds it needed to be able to provide that service to me, and ultimately save my life. And so now let's talk about preventing. Like what prevents that? Well, we talk about preventing things like heart attacks. We talk about preventing diabetes being so pervasive in our society. Some of that is simple, health maintenance that we can provide down to people to get in front of those big drivers of our cost. In the case of what I went through, maybe there was some driver in my past where I wasn't the healthiest, and that caused my situation. It's really hard to know what type of prevention can solve those catastrophic events, but there are some that we know can directly affect the money that moves around in the system. And some of that is just simply enabling people to maybe have what they need to live a healthier lifestyle, right? So, one of the problems we run into right now is, let's say that we know giving everybody that is 16 years old a electronic device to monitor their heart rate. And we know that over the course of their life is going to prevent X number of emergency room visits. Well, how do you prove that out to the payer that it's worth investing up front and not just waiting to be reactionary for when those catastrophic events happen? And so you aren't seeing, or you're starting to see some of this, but you're not seeing that payer really be incentivized to make people live a healthier lifestyle. And so I think the idea here is for us to think about, well, how do we take the opposite approach to this? And maybe I'll let Adam actually take this through, because these are some of the slides I didn't quite fully grasp his product perspective. Yeah. If you want to just maybe talk through from here.
Absolutely. So this is, when you look at the challenge, as Joe pointed out, maybe he had the opportunity to take advantage of some of these great digital health tools that would have prevented him from whatever illness he experienced. Or maybe it's even something that tends to be even much more clear, such as heart disease. The two of the apps listed there, we know both from a research perspective and just a pure data perspective, they have extremely positive impacts on someone's probability of developing heart disease. When you get heart disease, that costs the provider money, that costs you money, and it obviously costs the payer money, as Joe just showed. So this suggests, before, we were paying money to the payer, but they weren't necessarily able to offer money to a provider to get you to use Fitbit. But this just reverses the cycle and says, payer, you're going to save much more money by having, let's just say, Al never have a heart attack, because you just paid the provider maybe $500 to prescribe Al a $200 Fitbit. And in that way, you spent $500 instead of $5,000 or $50,000. So that allows the provider to say, okay, if I'm being paid to do that, then yeah, absolutely, I'll prescribe you this Fitbit. And not only will I prescribe you the device, it'll now become a part of your actual care. So I can check in on that. I can ask you, you were being active after your heart attack for the first 2 weeks. That's gone down. You realize you do need to keep this up. Is that going to work for absolutely everybody? Definitely not. But we do know that it will work for a large portion of the population. And so this just says, by simply focusing on the problem, just like Joe said, you want to engineer something that impacts the world and that is important. Figure out where your solution is actually going to have the largest impact. If you just try to fix it for the provider or the user, it won't actually change health. We focus on the pair, you achieve what you wanted to.
Okay. Thanks, Adam.
Yep.
And so the other thing we're going to talk about is change aversion. And we're going to talk about the patient with the clinician. Whoops. And the medical record. And basically the medical record, when we say EMR, we were talking about that as basically the source of truth for your healthcare experience, right? And we really, if it's not part of your medical record for our organization, it really is like it doesn't exist for our doctors and nurses. So essentially, the workflow here is you provide your doctor information about your health, either by submitting yourself for tests or in conversation and interaction. They put that into your medical record. And then going forward, those doctors will always reference that in order to provide proper care to you, maybe based on new or ongoing or a disease that maybe you're going to have the rest of your life. But that is really the place where anything about you that we need to know to provide your care exists as a data point. And then, this just represents, how lifestyle change is supposed to be communicated back to you as the patient, right? If you're have chronic issues that can be, say, alleviated by simple exercise, that's how that information is communicated back to you currently, is by the doctors. Now, well, let me go back. And so it's really that's the current state, right? You go, you get treated, you get advice or medication or whatever it is to solve that. And so speed is really a big factor in getting that into the clinician's hand to understand your current state. And so as we think about kind of the gap here, well, the gap here is information, right? The gap here is how can that clinician get data about you almost on an ongoing basis, right? How can that information be relayed back to maybe not your primary physician, but an organization that can help identify potential catastrophic events? Because we know the most expensive part of any healthcare organization, well, that's a trip to the emergency room, right? And so a lot of this opportunity is to create almost a ongoing view into somebody's health for the sake of providing that preventative care before it becomes that catastrophic event. And maybe even an opportunity then to adjust somebody's care without them actually needing to sit down, schedule a visit with that clinician or doctor, right? Not everything that happens in your life related to your health requires sitting in a waiting room for an hour and half an hour, or more likely 15-minute conversation with a primary doctor. So how can that be delivered in a new way that has the same amount of value and can have the same results, right? Because at the end of the day, those don't exist. But at the end of the day, having that continuum of care as a person into a system, and to have all that data driving changes and real changes you can make in your life, not just to be healthier, but to be more cognizant of the cost of what it takes to keep people healthy. today this really doesn't exist, right? If you're tracking your Fitbit or your Apple Watch pulse while you're working out, your doctor has zero insight into that, right? They have no ability to say, oh, while you were running that quarter mile, you had a heart palpitation, right? There's absolutely no connection to that in your primary care position or what you would consider traditional healthcare today. And so it really is a question of how do you bridge that gap? Because I don't think anyone would argue that that's not valuable information. But it's a matter of creating a system to where that's possible. And then ultimately being able to prove that back out to what I would call the status quo, to kind of prove that that's a valuable thing to support from a monetary perspective. So this is really where we are focusing our health hack. This is where we want to get, people that maybe are smart individuals that haven't been inundated with how healthcare works today to come to participate. Well, I shouldn't say to come, but to virtually come and participate in essentially what is a creative exercise to try to solve some of these problems. We're really looking for people that you don't necessarily need to understand how healthcare works today, right? Because honestly, how healthcare works today is a little bit broken. And this event is all about getting out of that traditional mindset, bringing new ideas, trying new things, proposing something and building something that adds value at some level. And so I don't want people to get hooked on everything that we just walked you through and talked about. But we wanted you to have this background so you understand the problem that this event is really targeting and trying to solve. And I also want to just call out that, being part of this event, it's not like you sign up, you have a couple touch points and you're gone. We're going to be able to connect you with people from either technical backgrounds such as myself and Wayne, or people within the healthcare organization to provide some guidance as well. It's not going to be as direct as it has in the past when we had the actual in-person event, but I still think this is a valuable thing to continue to do, to bring ideas, and really have you guys collaborate as really who are going to have to own this system in the future. All right. So this is Adam's personality definitely coming through. So who cares, right? Again, this is about you guys bringing ideas to us as Sanford Health, absolutely. But this is also about you guys thinking about where you want to spend your time and energy in your careers. Sanford Health is a pretty innovative organization. There's a lot of opportunity here, but you may walk out of this with some ideas of what you want to go out and do on your own, or maybe again where you want to spend your cycles in the world of business, because this, in my opinion, is the biggest problem we have in front of us to solve today. How do you provide quality healthcare for people, basically at a cost that we are going to be able to afford in 20 or 30 years? And if bridging this gap between what we consider digital and traditional healthcare, if that doesn't occur, it's not just a lost opportunity. In my opinion, it's going to be a catastrophic change in our society. So anyway, that's my spiel. So just give you some idea, last year we had an in-person event. We had this at the great Imaginetics building here in Sioux Falls, which is a great venue. We had about 50 students on 13 different teams. We had over $25,000 in prizes, and we had 12 Sanford Technology Solutions staff. This is a great way for you guys to engage with us. Again, as you think about, what you want to maybe spend your internship doing, but again, where you want to spend your career and really dedicate yourself to. I remember the interactions I had with some of the teams being extremely positive, and I was really blown away with some of the ideas that got presented and came up with. And this is an opportunity again for you to kind of participate in an event, sure, and get some prizes, sure, but really put on paper kind of what you've learned so far in your journey as well. And so last year, we had participation from a lot of different places. Dakota State. I'm not sure how many teams we had from NDSU, or I think maybe just one. But I mean, this is where we're trying to pull you guys and your talent from. Again, DSU, we had a pretty good representation there. I assume this picture is just DSU people. I'm trusting you, Adam. But the teams that had DSU participants actually took first and third place last year. So, this is where I just want to say, don't be overwhelmed by the problem or even what I've walked you through really lazily. This is something that you guys can dive into and, maybe fail, but still learn, right? So don't be thrown off by just coming down, participating, and at least I'm not coming down, joining us virtually this year, participating and seeing what kind of the process is like, and interacting with great people like Adam and myself and Wayne, of course. So this year I slipped up a few times, but we are doing fully online. We're having a 2-week kind of period of time where teams will engage, produce their solutions. And then we will narrow down to, it sounds like 10 finalist teams that will come back and present. Is that right, Adam? 10 presenters?
Yep. So you meet for a kickoff October 16th. So that's next Friday. And then you basically get to work asynchronously. At that kickoff, you'll get more detail about what's expected of your solutions and some basic access to technical details of what you need to do. And then you'll be able to go off on your own. And during that time, you can meet with subject matter experts from Sanford Health to give you guidance. And then you submit your solutions October 30th. There's a public voting session. And that's what creates that finalist list of 10 teams. And those are the ones that do a live demo on November 6th.
Yep.
So you join, get the requirements, you leave, do whatever you need, submit, and then the best of the best get to demo.
Yeah. And really, as you think about team size, think of that pizza-sized team, 2 to 4 people. We don't want teams that are too large. We want teams that can actually collaborate effectively virtually or in person if you so choose and are able to. And then again, that QR code will get you there, or I believe, did we put a link out there on the invite as well?
Yeah, Graham put it there for us.
Okay, great.
Thanks, Graham. And
so here's the prize breakout. So, once you've done you've made the top 10, you've done your presentation, the prize is first place, second place, and third place. Pretty sizable. So that's another reason to keep your team size small, right? And so here's the schedule. The kickoff is, again, like Adam said, is going to be next Friday with a deadline of the end of the month. So I assume, do we have a deadline for when we'd actually finalize the 10 teams, Adam? Like, will they know?
Yeah, that'll be announced basically November 4th.
Okay.
So we'll try to get you your info as soon as possible, but the 2 blue areas there are the ones you need to worry about that you actually need to show up online for.
Yep. All right. And like Adam said, the link to register is online. If you somehow are not online on the invite, if you somehow miss it, it's a real easy site to remember. It's just devpost.com and search for Sanford Health Hack, and it should bring you to all the additional details we just talked through.
Awesome. I see Graham has asked an important question. You already registered. Good job. Thank you for doing that. In order to enter who's on your team, you basically begin a submission. So there is a tab in DevPost that allows you to begin. It's just like a holding space for where you're eventually going to submit. You create your submission, and then that actually allows you to add team members to your project. And then it doesn't submit. You can save it. It doesn't submit until you're ready to say this is all done. Does that make sense, Graham? I can demo it if you'd like me to. Your silence says everything. I'll show. We'll see how fast I can demo an app I don't know much about. All right, so let me share my screen here. Share screen. All right, so this is DevPost. This is just a standalone hackathon site, so it's dedicated to hosting hackathons. Quite a bit different than last year since we're all online. This is Sanford Health, but since I'm the owner, it doesn't work necessarily perfectly well. So I'll just go and find somebody else's hackathon. So don't do this on Sanford Health's hackathon. But I'm just, again, doing this on someone else's to demo how you would do it. So you would come here, you would see join hackathon, click there, you register, you can choose, do you have teammates? I'm looking for teammates. Yes, I have a team, is what you'll choose if you've got a team. I don't care what you put here. I'm here for the learning, and I have read your terms, register. And so this is where you start. And then basically what you'll start to do, apparently these folks have not started there we go. So you'll go back to the overview page once you're registered, and you get to start your submission. Project name, project. Blockchain sprint ID. And that's a hill. I guess that's a hill. There. I do want to continue with my submission. All right, so now it's created. So think of it as creating the container for your project. I know that it's a little bit misleading. Unfortunately, we can't change that because it's their platform. But now you've actually started your project, and this is how you invite your team members. You can just type in their email, copy my link. I could send this to you, Graham, and you would get, if I put your name in your email here, send invite, you would get an email from DevPost. If I put that in the instant message, which I don't mind doing now, you could join my Project Delphi, and we could just crush this hackathon. Does that make better sense?
Yeah, and Graham, to answer your question, you don't necessarily need to finish the project before you enter your team. You probably don't. I think what you just walked through, Adam, kind of makes it look like, hey, what's your project, and submit it. But yeah,
you don't need to. You can do this right away when you start, or you can do it the night before or the minute
Yeah.
you're submitting, but this you can save and then submit it at a later time. So you're exactly right, Joe.
Yeah.
You bet.
But definitely come up with a cool code name, something better than Project Delphi. So
I was trying to, I planned that name for weeks, Joe.
I know. You had a hackathon to define the name, right?
So one last thing, we've got a survey for you all to check out. We're having a little bit of trouble deciding the best swag since this is a virtual event and we can't give you swag in person. We're going to ship some swag to you. Depending on the first certain number of teams that register, get level 2 swag, and then the finalist 10 teams get level 1 swag. But we want to actually know what you prefer. So there, I put a survey in the chat. You can go there and fill out what you like. All right. Any other questions, comments, input, suggestions?
So I guess then at the kickoff, you gave your basic overall theme, sort of expectations about how complete the project is, and make a number of your people available to be resources or feedback folks.
Yeah, on Sanford's side?
Yeah.
Yeah, so after the kickoff, you'll get detail about how you can communicate with different subject matter experts. You'll get to set up a time if you want to meet for feedback, and that'll just be over a Zoom call or multiple if you choose. And then we'll also have a Slack channel, so you can just post questions as they come up.
And make sure when you request a mentor, you're somewhat specific on what you're looking for. I know, I have a couple of team members that raised their hands. If you're up against a workflow or even just a technical issue, and then if you're looking for more, just what is this, or are we on the right track as far as what a solution would look like? I mean, just be as specific as you can possibly be and what you're looking for direction, because I'd hate to give you one of my engineers if you want to know how the payer system works.
That's a really good point, Joe. And we'll go over that during the kickoff, and there will be detail on how to request one on DevPost as well. And I recognize that not everybody, I didn't know about DevPost until I started a hackathon. So I recognize most of you probably don't have accounts. So tonight, to help you over that hump of creating an account, if you go there, register, and then email me, put my email in the chat window. If you go there, register today, send me an email with basically when you signed up, and I can compare it with the timestamp on DevPost. I'll send you back a Starbucks gift card for $5. If that helps motivate you. Graham, I think you literally just registered maybe a bit before we started this, so I'll go ahead and send you one if you send me your email you'd like it sent to. Yeah, Graham. Cool. All right. Well, unless there's anything else, Joe, Wayne, or Eric, unless you've got anything else to say, or Tom, you need anything else from us, we'll give you back the balance of your time, which is not much left. But
just thanks for joining us, bringing a whole team, and hopefully we get some students to participate next week and go from there. So
perfect.
Thanks for coming.
Sounds great. Thanks.